So when we're doing skull ultrasounds in the emergency department, there are a few key things that we want to remember in order not to miss a fracture. We're usually using them to identify fractures when a child presents with trauma and has a large boggy hematoma, and we need to make the decision whether or not to CT or not. Now, there are three key points that you need to take into consideration. The first being that make sure the child has good pain control, and this might be in the form of oral analgesics. But in terms of your transducer, make sure that you have tons of gel and that you're not putting any pressure on the hematoma. The second thing is to make sure that you scan all the way through the hematoma and at least 1 centimeter beyond the edges of the hematoma. And that way you're not going to miss a small fracture where the hematoma has moved beyond the edge of the fracture itself. The third thing is to be aware of your suture lines. Suture lines can look widened, and that can be a fracture through the suture. And also sometimes it's hard just to differentiate between a fracture line and the suture line, and that's when you want to compare to the other side as well. And you might be able to follow the suture all the way to the fontanelle, and again, that is a good indication of where you are in the skull.